Good afternoon, everyone. Hope you're all well and safe. Nice spring day. So I'm Nick Pearl, Chief Exec of the Society of Occupational Medicine, and hopefully you've all signed in for a webinar for an hour and a half on promoting workplace health and wellbeing, COVID-19 and beyond. And if you're in the wrong webinar, I suggest you stay because it's going to be very interesting. With some brilliant speakers, Emma Memo from Mind, Rachel Suff from CIPD, Abigail Hirschman from the Charlie Waller Trust, with Professor Gail Kinman at the end, talking about the fact sheet that hopefully you've all received, which just gives you a brief on it. We will be looking at the chat. Welcome to put your questions in there, and that will be fed through to the presenters. Do mute, because that obviously makes a nice clean webinar, and so everyone can listen carefully. And we will be recording this and sending it around to you, and the presenters very kindly have said that their presentations can be shared, so you'll get that too. But it's worth staying, I think, just to hear it. Don't don't just assume that you can catch up later. There's nothing like seeing it from the experts. We're really grateful to Charlie Waller, CIPD, Business and Community, Louise, our host for today, and Mind. They're great partners, produce some great resources. Just saying beforehand what great organisations they are to work with. Very lucky to have this sort of partnership, and it's testament to those organisations. Hopefully you've got a cup of tea and sit back, and it's a good time to listen, spend the afternoon listening on some experts. So just seeing a question about the fact sheet in the chat. You should have all received that. So if you haven't, then you could contact admin@som.org.uk, and my colleague Nick, who's sitting beside me, socially distanced, will send that to you. But you should have all received that. We've got a lot of participants, 230. I think it was put out at 500 odd. So normally we get about sort of 250, 300. So a lot of people, a lot of expertise on what is a key issue. I'm going to hand over now to Louise Aston from Business in the Community, who's your chair for this afternoon. Over to you, Louise. Thanks.
Thanks, Nick, and hi everyone. Yeah, I'm Louise Aston. I'm Wellbeing Director at Business in the Community, and I'm really delighted to take part in this webinar in partnership with SOM and Public Health England, along with splendid colleagues from Mind, CIPD and the Charlie Waller Trust, organisations that I have the huge respect for. So workplace health and well-being during this crisis has come out of the HR box and become the business issue. So well-being, along with the environment, has come to the fore during the pandemic and will hopefully remain firmly established in the future. So we're in a physical and mental health pandemic, and as a result, mental health has been hugely elevated almost overnight. So research findings show that the mental health and well-being of the UK population has generally deteriorated during the pandemic, with marked effects for those in employment. The recent resignation of KPMG's COO, who criticised his staff for not displaying empathy and compassion by telling them to stop moaning about the impact of the pandemic and lockdown on people's lives, and to stop playing the victim card at an online meeting with 500 staff, demonstrates that emotional intelligence and active listening is now a crucial leadership skill. As we've seen in earlier webinars in this series, different groups of employers have been disproportionately affected. Although support is available, it often targets individuals and overlooks the need for a systemic, organisationally focused strategy. So this webinar will highlight the need for effective policies and practices at an organisational level to help support the mental health and well-being of all employees. The aim of the session is to share practical examples of best practice to enable employers, large and small, public and private, to introduce systemic well-being interventions. So we have a really superb lineup of excellent speakers who are colleagues and friends, who are expert in their field and passionate about employee mental health and well-being. So I'd like to start by introducing Emma Marmo, Head of Workplace Wellbeing at Mind. Hi Emma, how are you doing?
I'm well, very good, very happy to be here with you all today. Looking forward to the discussion.
Brilliant. Do you just want, I'm going to give an overview of what you're going to be talking about, but do you just want to say a few words about yourself?
Absolutely. So I'm Head of Workplace Wellbeing at Mind, the mental health charity. I've been there for about 13 years, but I've focused on mental health in the workplace for the last 10. And yes, as Louise has said, we've really seen conversations about mental health accelerate during this time. So that has been very positive. But yes, that's my brief history.
Yeah, it's brilliant. So Emma is going to be talking about mental health in the workplace, understanding where we are now and how to respond. And so it's about the impact of COVID on all of us, how to support your people within an organisational context and guiding principles. She's also going to provide a really important focus on employees who are key workers, those who are working from home and those who've been furloughed. She'll also be talking about supporting employees with long COVID, which is becoming a really important emerging issue, and those who are going through change, including managing and uncertainty and impact on job loss. So really looking forward to your presentation, Emma. And now I'd like to move on to our next speaker, Rachel Suff, Senior Policy Advisor at CIPD. Rachel, do you want to say a few words about yourself?
Yeah, really happy to, Louise. Hello, everyone. Thanks so much for joining us. Yeah, so as Louise said, I'm at the CIPD and I'm in the public policy team. I've been there for about 6 years and I lead on employment relations and health and wellbeing. And I think with Business in the Community, Louise and the other organisations, we've been really collaborating intensively over the last year since the pandemic, before that as well, but we've been really working together. So having the opportunity to speak on this webinar is great as well.
Yeah, thanks, Rachel. And yeah, I mean, everything is about collaboration. And I do think that in the wellbeing and mental health space, organisations have been particularly good during the pandemic. So Rachel is going to be talking about the critical value of investing in good management to support people's mental health within the context of the pandemic, which has increased both physical and mental health risks, which in turn has increased the responsibility and complexity for managers. So Rachel will highlight why line manager behaviour is so important to supporting people's mental health. We know that line managers play a really vital role in determining the health, wellbeing and engagement of their team. And Rachel's also going to share with you a suite of practical resources developed by CIPD. I'd now like to introduce Abby Hirschman, Director of Workplace Programmes at the Charlie Waller Trust, which is a mental health charity. Abby, would you like to say a few words about yourself?
Sure, thanks, Louise. Hello, everybody. It's so nice to see so many people here. It's in some ways, although I'm not mad about digital delivery, I'm getting used to it. Actually, when you're all on screen, it's easier than when you're suddenly faced with 250 people in front of you. So there is something nice about doing it this way. So my name is Abigail and I'm Director of Workplace Programmes for the Charlie Waller Trust. Until recently, I was Head of Mental Health and Wellbeing for ACAS, the arbitration service. I started my career, though, as a psychotherapist, and I worked for about 15 years with people who had emotional and psychological distress. And then I moved into the workplace because I was much more interested in a way of looking at what the predictors were, what some of the things that were going on at source that we could do collectively, the areas we could control and help people in that workplace environment. So thank you. Looking forward to speaking later.
Yeah, thanks, Abby. So obviously to do with what are distressing times for many people is you can't manage what you can't talk about. And Abby's going to talk about having meaningful conversations with someone in distress. So she'll cover spotting the signs, often challenging while working remotely, including tone of emails, voice and non-verbal clues. She'll also introduce a conversation framework which covers boundaries, empathy, guidance, information and next steps, along with Charlie Waller's framework for mental health and wellbeing at work. And last but not least, I'd like to introduce Professor Gail Kinman, Chartered Psychologist and a Fellow of the British Psychological Society. Gail's acted as content advisor for this webinar and fact sheets, and Gail will be supporting our Q&A session as well as writing up a summary of the session. So big welcome to all our speakers, and Emma, could we kick off with your presentation, please?
Yeah, very happy to. I've got to do the sharing screen. Brilliant. Okay, so yes, as Louise already laid out, I'm just going to talk about where we are now, thinking about all the challenges we've had to face over the last year and the beginning of this year, just thinking about different groups and how they've been affected. You know, we've all been in the same storm, but not the same boat. So just trying to understand those different groups, different communities who've had different experiences, but then trying to share some general guidance, guiding principles in terms of how you can support people. So yeah, I think for me, it's that interesting thing around how to have a good conversation about mental health, how to do that at scale if all of your staff are struggling and so on. So it's just trying to think about what are some of the tools and practical approaches that you can adopt. In terms of Mind as a charity, in case people aren't too familiar, our mission is simple. We're here to make sure that anyone experiencing a mental health problem has somewhere to turn for advice and support. But another key part of what we're working to achieve is campaigning to improve services and support and funding for mental health services, and then thinking about how to reduce stigma, raise awareness, promote understanding. So those are the two elements. We're here to provide advice and support to people, but we're here to campaign and influence for change. And obviously my team and the work that I do is looking at changing policy, practice and culture within workplaces, and doing that in collaboration with the speakers on this call and many of our extended friends and family in this space. So that's just a little bit about Mind. In terms of reflecting on the pandemic, well, when we think back to a year ago, at the start of March, when, you know, the directive from the PM to work from home if you can was given, and then thinking about, you know, lockdown and so on, going into it at Mind, we were thinking, right, okay, what impact is this pandemic going to have on people's mental health? How are we going to need to respond? And you could see that it was going to cut across all areas of well-being, our physical health, our mental health, financial well-being, social, and so on. Also recognizing that for even individuals, that impact will probably be in many ways and at different times. And I can definitely reflect on that as an individual, having gone through it, just that roller coaster of emotions and so on. But then thinking about the impact on mental health specifically, it is, of course, the health anxiety that goes with a pandemic such as this. Will I get the virus? Will friends and family, etc.? Then there's the fact that the restrictions on our lives, the social distancing, the uncertainty, the isolation as a result of that, limiting our access to the things that would normally keep us well, protective factors, all of that is another issue to contend with. And then, of course, the huge loss of life that we've now seen, the bereavement that people have experienced, but equally for those working on the front line, the trauma they've experienced, both in terms of the loss of life of patients, but amongst colleagues and so on. So just thinking about that was what we were anticipating going in, and Mind led a survey during the first lockdown period to really understand people's experiences. But there's been lots of other research, and I'm going to be drawing on that during this presentation just to contextualize it. I mean, a lot of this we can kind of anticipate, and common sense would tell us this is what we're all experiencing just from our own experiences, but just trying to share insight as well. But thinking about where we are now, well, we're a year into nearly the lockdown and the pandemic. We've experienced multiple local and national lockdowns, differences across different regions. But yeah, just thinking about that year of restrictions on our lives at different times. As I've already said, the unequal impact of COVID. So people from the BME community experiencing a higher loss of life. Is that because of the jobs that they're more represented doing, because of shared housing issues around that? It's probably a mixture. thinking about women and, again, the health risks, again, from being represented in key worker roles, thinking about the economic impact of the pandemic, younger people feeling that more, maybe because they're overrepresented in the industries that have been hardest hit and will probably take the longest to recover. Obviously, we've had the indicative roadmap of coming out of the restrictions shared earlier this week, but again, health, leisure, hospitality, leisure, and so on, those sectors staying closed for longer and the impact of that. We also know that people's experiences, if they've been shielding, the higher restrictions they've had to face. There have been issues around working parents, but predominantly this has also been working mothers who have taken the burden potentially of the kind of childcare responsibilities and homeschooling, and working parents, and by extension working mothers, have been identified as a key at-risk group because of worsening mental health. Increased concerns about loneliness and isolation. The Mind survey that we ran in the first lockdown period showed that the key drivers for poor mental health were isolation and loneliness, as well as then the fear of getting the virus. The Office for National Statistics have also been tracking this, and we were paying attention to the data shared in November as we went into the longer, darker months of winter. And I think it was sharing that around 8% of people in November were reporting feeling acute loneliness. That's around 4.2 million. That is the highest that was recorded during the pandemic period. And before the pandemic, that was normally around 5% of the population reporting that. Again, younger people reporting being more affected and feeling more isolated. It also looked at people who hadn't left their house in the last 7 days, and that was around 5%, so 2.6 million people. So that's the kind of concerns that we have. Obviously, that's further compounded, with winter and the impact on our sleep patterns and our mood because of serotonin levels, etc., etc. So the lack of sunlight as well, circadian rhythm. We also know this flu season in and of itself will put more burden on the NHS and so on. And then I think the big story of this year is, of course, going to be redundancies. They're already at record levels, but there's predictions of 2.6 million people unemployed by the middle of the year. Some stats I saw this morning predicting 1 million young people unemployed. So again, another at-risk group in those broadest terms. So that's kind of thinking about where we are now. But I think reflecting on last year, there are other events that happened which were as a result of the pandemic. So obviously the impact on the mental health of children and young people because of the disruption to schooling, the issues around all the school results and so on, the impact of NHS on pause, or, people not being able to access support, but equally people feeling that they shouldn't be accessing support at this time since it was under such extreme burden. That was definitely reported by people with mental health problems who would normally be seeking support for their mental health, saying, I feel like my problem isn't serious enough during this time. I think also, so those are definitely things linked to the pandemic, but broader events, obviously the very tragic murder of George Floyd and the renewed focus on the Black Lives Matter movement and just understanding about institutional racism and whiteness and so on. And then if you think about Brexit, the rise of transphobia and some government policy not going as far as was desired around transgender issues and so on. And then, of course, the pandemic and the term doom scrolling, so just overly consuming very negative news and the impact that has on people's mental health. And then finally, of course, climate change. And of course, Louise already talked about issues around and the environment and people's anxiety around that. So it's just reflecting that we've been through some tough times over the last year and a half, and a lot of it's been about lack of control around our own lives and what we can do, high levels of emotional distress and trauma, and then thinking about there was a great rise of unity, clap for NHS and so on, but there's been a lot of division as well. So just kind of reflecting on the other things that might be affecting your employees during this time. So in terms of how to support your people, I mean, thinking about Mind ourselves, we have our retail shops. They've been furloughed a lot during this period. We've had people working from home predominantly, but we did have our office open so people could go in for wellbeing reasons. Some business critical roles were going in weekly, and, that's just Mind. And we've been doing restructures as well because we've had to respond to the impact on our income. So thinking about organisations more broadly, I'm sure you've all been going through similar. You might have staff that are attending a workplace, staff that are working from home, staff that are on furlough or flexible furlough, and then you're having to manage the impact that might be having on other staff who are still working. people going through change management or having just come to the end of change management and now implementing change and transitioning, redundancies and so on. And of course, in terms of the work that you do, have you seen increased demand or decreased demand? Not being able to operate as you normally would. So just thinking about all of that might be happening in one organization. So thinking about how do you respond? So very much trying to think through some guiding principles. So this is to absolutely think about in terms of your staff, but also to think about yourself. How are you supporting your well-being? How are you seeking clarity and getting that for yourself in terms of your role? What's your community and where you can access support from, and being reflective about what's working for you and what's not working for you in terms of your job. So I think they're just helpful for all of us to think through. But indeed, in terms of senior leaders, HR professionals, line managers, thinking about the well-being of your people absolutely has to be the priority. And you need to understand people's individual circumstances. So having routine catch-ups, asking about their well-being, asking about what's working for them in terms of their role, what support they might need, and just being really responsive in that. The second point is about giving people clarity around priorities, organisational priorities, team, individual priorities. If you're developing new policies in response to the changing environment, just being very clear about cascading that to staff so they understand that they need to work within these new policies or how to access support or whatever's changing and so on. And then I think around processes and focus on simplification. And I think this is probably more pronounced for people working from home. And we've been talking about, system overload, if you're setting up new platforms, and, we talk about being zoomed out and so on. So just trying to think about how you can consolidate and focus on simplification for staff so you can make those operational challenges a bit easier. And thinking about community, again, if you've got staff attending a workplace or staff working from home or a mix, just thinking about how you can still create a sense of community, giving people regular updates, two-way dialogue, so you're getting feedback from people, and just building in time for social connection, especially if working remotely. So within Mind, we've been doing random coffee initiatives, so people have buddied up across the organisation to have coffee with each other. Other teams have been doing 11sies, so everybody stopping work at 11, getting together and having a virtual coffee, etc. Just thinking about ways in which you can try and facilitate people being able to access that peer support that would happen naturally if everybody was in the same place. And I guess another point is if you have got staff attending a workplace, some working from home, some being furloughed, how you can still build a sense of community across those different working contexts, especially if there might be some challenges for those still attending a workplace and feeling like, well, we're at a higher risk. So just trying to think about how you can understand how people might be connecting with emotions and trying to build that sense of community across the organisation. And then the final point is just about being reflective and taking stock. We all had to spring into action quickly at any point when changes have been brought in, but then thinking about, well, what we had in place for the last couple of months, is that going to get us through the next month, the next couple of months, and seeing it very much as test and learn. And as I said, getting feedback from your teams about what's working for them. In terms of a very helpful tool, so for many years we've been promoting wellness action plans. It is based on a tool that someone would develop with a health professional to manage their mental health condition, but we adapted it with permission for a workplace context because it's a really helpful framework to get to what this looks like for an individual. So what are the things that will keep me well at work? What are the things that might make me struggle? What are those very individual triggers? What are some early warning signs to look out for my manager? Very important now if we're working remotely to really think about what those indicators might be and have that discussion. And then what are some steps for the individual to take to manage their mental health, and then steps for the line manager to take to facilitate that. So we've adapted the guidance for a working from home context, so that's all available, and very happy to share resources. But again, it just gets to that very individual, well, what does this look like for me, and how can you support me as my line manager? But being very clear on roles and responsibilities within that. As Louise said, I'm now just going to focus for a few moments just on key different groups within the workplace, what they might be going through and how best to respond. And to say this isn't exhaustive, and this isn't to say that all key workers will be experiencing this. I mean, they may, but to a greater or lesser degree. But obviously we know for key workers, and that includes people working on the front line, so NHS, social care, emergency workers, as well as then a very broad church of workers in terms of people running essential services and leaving their homes, during, the lockdown periods, leaving a place of safety to kind of keep those essential services running. We do know that key workers versus non-key workers are more likely to say that they have too much work to do. They're also more likely to say that their mental health is being negatively impacted by work. We know that retail staff have been experiencing high levels of verbal and physical abuse from customers, during, the lockdown and, very challenging situations. We also know that staff working in intensive care units, many of them, around 50%, would meet the threshold of PTSD, so post-traumatic stress disorders. So just trying to think through key workers and what they're going through, but it's of course the exposure to COVID, the worry of transmission and taking that home. So just making sure adequate safety measures are in place and clearly communicated. Obviously, this has been in place for, during this whole period. But I think, exposure to trauma and making sure that appropriate support is available to people at the time they want to access it. If they are experiencing challenging situations, how can you encourage peer support and debriefing after those challenging situations so people can process what's happened, seek support if they want to, or just talk it through. And thinking about impact on resilience, so encouraging self-care, so before, during and after shifts. So we did a lot of work funded by the government with emergency workers and by extension, emergency department staff who, very busy roles, said we cannot ever do any wellbeing support during a challenging shift, but we've actually developed in partnership with them some bite-sized tools for managing your breathing during a period, thinking about how you can shut down from a shift and kind of process it, reflecting on successes from the shift, any challenges, how to let them go, and coming up with a signal that helps you switch your focus from the shift to your downtime and kind of recovering during that finish from work. So yeah, happy again to share some of these tools. And then I guess thinking about burnout, so managing staffing levels and having regular reviews on that. Employees who are working from home, there's been lots of research during this time about increased working hours, the blurring of home and work during this time. And this has always been a paradox of agile working more broadly. Yes, it gives people greater work-life balance, but equally it can introduce this idea of always on. So just trying to support staff with clear boundaries for their working day, even if they want to or need to work flexibly, but just making sure that they aren't doing extended hours across that day. I've already mentioned system overload, so just thinking about how you set up rules and frameworks for using those different systems and managing email traffic and just trying to ease that burden. Access to support, so obviously if people are working remotely, just making sure line managers are having regular catch-ups with their people. Again, burnout, being clear about priorities and offering flexibility again for working parents, very key during this time. I think everybody who is a parent is very much looking forward to the schools going back and having that responsibility eased somewhat. And then, yes, as I said, about isolation, so encouraging social connection and peer support. So in terms of employees who've been furloughed, we know at the peak of the lockdown period, there was about 8.9 million people furloughed. That dipped down to 2.4 million in October. I think that, we would have seen those numbers rising through November, December and January and where we are now. In terms of the industries, it is kind of accommodation, food services, leisure and entertainment, arts and so on. Again, the greater proportion of younger people represented amongst that group as workers. We do know that being furloughed is better to have a continued connection with your organisation, even though employers have struggled to support staff during this time with isolation and lack of structure. But I guess it's then thinking about when the furlough scheme does end and people coming out of that, it's a real transition point, which we know can be a real trigger for poor mental health for people, especially as you think, well, what happens now? Will I have a job, redundancies and so on? So just trying to provide reassurance to people when you are about to bring them back, thinking through that reintegration. So, having regular wellbeing check-ins, developing return to work plans, helping them re-establish a routine, being mindful if they do have any caring responsibilities. I think it's also about maybe reflecting on what impact being furloughed might have had on people's self-esteem, their worth in the organisation or their role. So just being transparent about how decisions were made and being able to provide reassurance. We know that with furloughs, some things haven't gone so well. We also know there's potentially been some poor practice with people still asking staff to work. So I guess it's to think through, will there need to be any reparations around decisions or behaviours during this period, and how you can kind of engage people with giving feedback and having that two-way dialogue. And obviously, if people have been at reduced wages during this time, signposting people to financial support, either that your organisation can offer, but externally as well. So then thinking through employees who have got long COVID, so this is people still displaying symptoms after 4 weeks. I think the Office for National Statistics has shown that 1 in 5 people are still showing symptoms after 5 weeks. So I suppose it's to think through, if people are coming back into the workplace, again, phased return, how best to support people. It's still quite unknown. Obviously, Society of Occupational Medicine have already shared the link to the excellent guidance they've produced on how to support staff. But I guess it's then trying to think about, if they have been out of the workplace for quite some time, or are going to be out of the workplace for some time, again, feelings of isolation. So how do you maintain communication? Thinking through the frequency and the method of communication to be really agreed and defined by the individual and what works for them. I suppose what we always know, if people have physical health conditions, that can obviously have an impact on their mental health. So just trying to support people with managing the impact of living with the symptoms might be having, on their ability to manage their day-to-day life, and how that would impact on their mental health. Thinking about their return to work, again, similar to people on furlough, just having wellbeing check-ins and developing return to work plans, thinking about phased return, any adjustments they might need, and then the ongoing support you provide to someone as they come back, and adjusting those return to work plans and adjustments as needed. And then I guess, again, it's reflecting if it has a long-term impact on their physical health, how that might then impact on their mental health. So again, trying to signpost people to internal and external support available. This is all still so new, and there's more information and insights being gathered. So I guess it's then just making sure you can share what you can with people. In terms of my final bit, it's just reflecting on the massive disruption that COVID has had to how we live and work, and how organisations across the UK are operating, the long-term impact of this. There's still a lot of unknowns ahead of us. And I think, managing uncertainty at an individual level, but also at an organisational level, is challenging. But thinking about staff who are going through change, just trying to ensure good, clear communication. It needs to be sufficiently detailed and streamlined. And I guess it's about sharing what you can, when you can, and just managing that quite strictly within the workplace. There's always, the challenges of some staff finding out stuff sooner, and the impact that has in terms of the rumour mill and so on. So just trying to think through how you can manage communications in an effective and helpful way that puts staff wellbeing at the front of that. Obviously, we know that people going through change and feelings of powerlessness can be a challenge. So how you do good consultation and seek staff input, exploring options and alternative solutions and proposals offered by staff. And if things aren't being taken forward, then being very clear about why, and just having that two-way dialogue with staff will help. The impact of job loss. So again, thinking about how you can signpost people to internal and external support, how you can support people with transitioning out of the organisation, CV workshops, supporting people with, job interview practice if they've been in their roles for quite some time. So just trying to think about how you can support people. And we know that people respond very differently to change. So again, thinking about tailored support and an approach for each of those different employees. And we know that it's not just about people going through the change or people transitioning out of the organisation. It's also being mindful of the impact of people left behind. So the idea of survivor syndrome. So again, maybe having to think about any reparation you might need to do around the impact of decisions or actions taken during the process, and just being able to be transparent about that. So that, I think, was what I was going to cover at this point. So I'll stop sharing my screen, but if people want to access, I'm happy to do a bundle of resources. I know I've mentioned quite a bit, so happy to do that as follow-up, but you can obviously visit the Mind website and find out more, or email the team. But I hope I'm to time.
Yeah, brilliant, Emma. Fantastic, really comprehensive. And gosh, I mean, you've thought of everything. It's just time for a really quick question. This is a kind of remark from one of our delegates saying we're super sad to see the end of the Time to Change pledge, and we've been looking to partner elsewhere isn't this a great segue to plug the mental health at work commitment?
Yes, indeed. So, I mean, in terms of people that aren't familiar, Time to Change is an awareness raising campaign to change public attitudes about mental health. It's been running for 10 plus years. The funding has now come to an end, and there was a program within it that focused on discrimination and stigma in the workplace, and it was the employers program, which had a pledge. But you know, there have been so many developments in this area for over the last couple of years, including the Thriving at Work review, which the government commissioned, looking at employer policy and practice. How can we get some core standards adopted by employers around supporting the mental health of their staff? So that was reported in 2017. It was then updated, those standards, to then develop the mental health at work commitment. So the Time to Change pledge, I guess, has been replaced by the mental health work commitment, which is actually a pooling, you know, a kind of, not pooling, that's not the word I want to use, a consolidation of the various pledges, commitments, charters that have developed during this time. So yes, that if people want to be looking for a simple framework to adopt, then absolutely the mental health at work commitment is the place to go.
Brilliant plug. Thank you so much, Emma. And it's with great pleasure I'd now like to introduce Rachel from CIPD. Welcome, Rachel.
Hello, everyone, again. That was so fascinating, Emma, and hopefully I can lead on from where you left off. So investing in good management to support people's mental health is what I'm going to focus on. First of all, just to show you a little bit about the CIPD, some vital statistics in case you're not familiar. I want to draw your attention to our purpose, which is on the right-hand side of this slide, and that's to champion better work and working lives, because a core part of that purpose is to ensure that HR professionals and organisations and managers as well, on a day-to-day basis, create workplaces that support people's health and well-being, including their mental health. Now for us, that means, of course, making sure that you have got effective, specific health and wellbeing support, like occupational health, employee assistance programs where you can. Of course, that's a given. But for us at the CIPD, and I know everyone else speaking on the webinar will agree, it also means providing good work that's good for people's health, that not only doesn't make people's health worse, but actually can enhance it as well. And that means ensuring that you have good, compassionate leadership. And Louise referenced that in the beginning of this webinar. Also the right culture to support people's health, and day-to-day effective people management. Now, all of these organisational factors play an important role, and they're interrelated, of course. But I'm going to focus here in my talk on the last dimension, and that is the role of people managers. And just to put that in the current context, which I think Emma's done a brilliant job already talking about the current situation in terms of the heightened risks to people's health and well-being that have become so much more obvious in terms of the mental health risks as the month on month this crisis has played out in people's lives and in the workplace. But I do want to just touch on that very briefly again, because it has major implications for managers and how they can best support people's health and well-being at work. Of course, we've got the general backdrop that everybody has been experiencing in terms of heightened anxiety, uncertainty, and that is a continuous thread over the last year and so on. But then within that, we've got what Emma talked about so well, which was that disproportionate impact that has been felt in terms of different groups of employees experiencing some of the challenges in different ways according to a whole myriad of different factors. Risk of infection, greater for some groups. Also, whether you've got caring responsibilities or not, working from home or not, are you furloughed or not? Are you going to be made redundant possibly or not? At the same time, playing across all these different challenges and how they're impacting on people in different ways at different times, you also have many people, whatever their job, key worker or not, facing new work demands, in a lot of cases, different work routines as well. Now, obviously all these, and some people will be experiencing all of them or some of them at the same time, and they'll be fluctuating. They're going to affect people's ongoing experience of work and their own mental health, as Emma's outlined. And that means that now, at this time of crisis, the role that line managers play is going to be even more important, and the responsibility and complexity, as I've said on this slide, that they're facing is going to be even greater. Now more than ever, line managers will be the main link between the organisation and those individuals that they manage who are going through all this at the current time. And if people are working from home, and according to latest data, around a third of the workforce in this country are now still exclusively working from home, in that situation, line managers are very likely the only link between the individual and the organisation. In that situation, they're going to be typically the first port of call for people if they've got concerns about anything that's going on at work and in their own life as well. If people need changes, support, flexibility, and so on, or even if they're just feeling quite overwhelmed by the situation. And it works both ways, because the line manager is the main link for the individual very often, but also in terms of any support, health and wellbeing, services and so on that the organisation offers, that will come through the line manager from the organisation to the individual as well. So they really are a really important conduit and support for people in terms of helping to ensure that people access any support that's available for a start. And with all that increased complexity that people are experiencing in their lives, so has the responsibility and that complexity that managers are experiencing in terms of how they can best support people in terms of their health and well-being, and how they manage people generally as well. So just moving on, we know at the CIPD that good people management is a really important part of the picture in terms of effectively supporting people's health and well-being. But we also know there's not enough investment in that aspect of their role. And this is based on over 20 years research and so on at the CIPD. And just to give an example, a sample really of that increase in expectation over the past few years, in particular on line managers to support people's health and well-being, including their mental health. So from our research, we know that line managers take the main responsibility for managing short-term absence in organisations. They also play a major role in managing people when they're on long-term sick, will be the main point of contact very often. Also supporting people when they return to work, line managers again. And then if we think about presenteeism, and we're still seeing that now, even if people are working from home, so working when well, not a healthy practice. Our research shows that in terms of how organisations try and tackle that, 2 of the 3 main ways is looking to line managers in terms of training, guiding them for managers to send people home sensitively, and so on. If we think about work-related stress, major phenomenon in organisations, one of the most common approaches is to train line managers to manage stress. So again, they're seen as playing a really important role. But as I said at the beginning, as this slide emphasises, the level of responsibility that's increasingly put on line managers to manage people, support their health as well, is not matched nearly enough in terms of the investment that organisations make in training managers, giving managers ongoing guidance, support, educating them about mental health issues as well. the need for that support is even greater now, as I've outlined, in terms of that increased complexity that many organisations are experiencing and expecting line managers to manage in terms of their teams and the people in the teams as well. At the same time, line managers, of course, have got an operational role, and they will be dealing with increased demands in that respect as well as their organisation responds to COVID-19. We know at the CIPD that managers are very often the squeezed middle and face competing demands. They're under pressure to deliver on both their people management role, supporting people's health and well-being, but also in terms of delivering on all the operational targets. And typically it's the managing people dimension of their role that becomes marginalised, and they have to prioritise operational priorities. And that's because there is a bit of a flaw in how their managerial role is not always, but often set up. And that it means that people management, that side of their role is seen as a bolt-on, and it's not seen as very integral. And that actually, if you support people, manage people really well, support their health and well-being, it will make it easier for you as a manager to deliver on your operational side of the role as well. The two should go hand in hand. Also, what we find is that very often managers are promoted into their management position based on their technical capability, not necessarily because they're good at managing people. And often the training and competency frameworks just aren't there to give them the support they need in terms of managing people. And then to illustrate that, because managers also need, as well as good management development programs and so on, to be a good people manager, they also need specific education training in areas like mental health to make sure that they feel confident and comfortable talking about mental health and having conversations where people want to in their teams. And if we just look on the left-hand side, it's illustrated here. This is our annual health and wellbeing survey, the green infographics here, and just some findings that I wanted to flag around mental health. So we can see that only half of organisations, 51% in the top stat there, have trained their managers to support staff with mental ill health and stress and so on. Therefore, it's not, and we don't mean train managers to be medical experts. It's important to say that. But yes, managers can play an important role in spotting early warning signs of stress, encouraging early intervention for people to get support, effective rehabilitation, return to work. They do play an important role there. But moving down, you can see the consequence of that lack of guidance and training, because the second statistic shows that less than a third, 31% of our HR professionals, because they were our sample, say that managers are confident to have sensitive discussions with people in their teams and signpost them, crucially, to more expert professional sources of help. And then the third stat at the bottom, even lower levels of confidence in managers to spot those early warning signs of mental health and distress in their teams. So there's a gap there in terms of what is being expected of managers and how competent and how much investment there is in their training to make sure they can rise to the challenge. And then on the right-hand side, we've been surveying employees every month since the onset of the pandemic to see how have you been affected at work with the pandemic, how is your health and well-being. And one of the questions that I've put here we ask is, since the onset of COVID-19, has your employer or line manager checked on your health and well-being? This is something that Emma just talked about, how important it is to check in on people, how they are. And 2/3 have. Employees said yes, my manager or employer has asked how I am and so on. but then a third haven't been asked. And this was asked many months into the pandemic. So that finding is disappointing. And a lot of organisations have been changing their sort of one-to-one practice over the last few years, and making sure that concern for people's whole health and well-being is included as part of that catch-up conversation. At CIPD, it's the first question that your manager will ask you, and you don't have to talk about how you are feeling, but it's very much there. It's an open conversation. The manager makes himself approachable and makes it very clear that he or she is asking how you are and not just how your work is. And where that is embedded as part of the ongoing conversation that you have with someone in your team as a manager, that can, if it's done in an appropriate and sensitive way, and I know that Abigail's going to come on and talk more about this, then that can really encourage the sort of climate where people feel safe to speak up. And that does mean appreciating all those demands and stresses that we've talked about so far that are evident in people's lives at the moment. And there has to be a trusting relationship between a manager and employee for that to happen. It's not going to happen necessarily in an automatic way. And to develop that trusting relationship, it means having the right behaviours as a manager as well, and as an organisation nurturing those behaviours. Because why is line manager behaviour important in terms of supporting people's health and well-being and their mental well-being as well? Because from our research at CIPD, we know that, yes, it's vital to have good health and well-being support and services in place, like occupational health. They're a given. Also having people management policies like flexible working in place that can support people. But we also know from our research that it's how managers go about their job and how they manage people, as well as what they do, that can really have a significant influence on how people experience work and their sense of well-being as well. I mean, just to demonstrate that in a negative way from our health and well-being survey as well, every year it shows that when we ask HR professionals about what are the main causes of stress on people in your organisation, year on year, they tell us that it's management style. I mean, workload is the biggest cause. And again, that's within very often the gift of managers to help control level of workload, but it's also management style. And, you know, by that we mean how a manager behaves, builds that relationship and goes about their role. I mean, the flip side is that managers have the potential to have a positive impact in terms of their behaviour. And there's various research out there that, not just ours, that shows how different management and leadership approaches, like compassionate management, for example, can have positive outcomes on health, well-being and engagement as well with your job and with the organisation. So what kind of behaviours do we mean? What can make a really quantifiable difference to people's well-being? And if we take compassion, stay with compassion, and Louise talked about the importance of compassion as well. I want to mention it too, because I think can be more important at the moment. But also by compassion, we don't mean, you know, that's not a fluffy concept. It means, what does it mean in practice? Well, yes, it does mean not being afraid of emotion. It means showing empathy, putting yourself in someone else's shoes as a manager, understanding what they might be experiencing. It does mean being kind and so on, but it also means being prepared to take action, to try and make a difference, putting support in place, for example, to help somebody's health and well-being and how they can fulfill their role. And reconcile the pressures that they're under externally as well, especially at the moment. So it means looking at that whole person, and not just their interaction with work, but how that interaction with work might be influenced by what they're going through externally. So compassion, very important, but it means taking action as well. Also, it means, and this is based on years and years of research that we've carried out with organisations like Affinity Health at Work, on how a manager can behave and the behaviours that can make a real difference. And it's all set out in tools and resources that I'll come on and show you, but it means being positive, approachable, showing concern for somebody's well-being, avoiding unhelpful criticism, crucially building that trust-based relationship, because behaviours don't happen in isolation on their own. It's how they're embedded and built and fostered and help to create that relationship with somebody, because it's only by really knowing somebody within your team that you can start to appreciate if they might be feeling stressed or not coping. You have to know somebody to really pick up on some of those early warning signs. But it means also helping to create that safe environment with somebody in your team, and appreciating somebody as an individual, and so that people can feel safe to speak up if they have got a concern. So being approachable. And then it means you can have a role as a manager in that early intervention, which is so important in terms of preventing harm to people's health at work. If support and changes at work and professional support, occupational health, whatever support is needed can be brought in at the earliest opportunity, that can make a really big difference to people's ability to carry on working. And what I've outlined so far in terms of what a line manager's role is and how their behaviour makes a difference, there's a big ask of managers. We're expecting a lot from managers, and it can be challenging to manage the health and wellbeing concerns that will be in their teams, especially at the moment. And that's why they need the support, the training and the ongoing guidance, because it requires a lot of emotional intelligence on the part of a manager, self-awareness. What impact does their behaviour have on people in their teams? Can they flex their management style to suit different preferences on the part of people that they manage? And we know as well that being a line manager is a really busy, demanding role. They're often time poor. They're not given the space or time to actually have the conversations that could make such a difference to people's health and well-being. Now, I just mentioned the tools and resources and the behaviour sort of frameworks that we've developed at the CIPD based on years and years of academic and practitioner research with Affinity Health at Work as well. And there's a link, I know you'll be getting the slides afterwards. We've turned that very thorough evidence into really practical, accessible tools that are free to download for HR, for employers and for managers as well, to help put those kind of behaviours and approaches and so on, like compassionate management, into practice. So there's a link there. Now, just to sum up, so I think my time is coming up, just want to leave you with a bit of a recap, really, because everything I've talked about is encapsulated in these 3 guiding principles for organisations, for line managers, in terms of how you can make a difference as a manager to people's health and well-being. But first of all, again, I want to emphasise what a line manager role isn't, because that's just as important, and that is that we're not expecting managers to step into any kind of clinical territory, act as a counsellor. In fact, that is why line managers do need the training and the awareness and the support, because They need to know where the line lies between listening, encouraging conversations, empathy and so on, but actually where they really are stepping outside what they're qualified to do, and where they need to refer onto expert sources of help like occupational health and so on. And so just quickly running through 3 guiding principles: the importance of building that relationship built on trust, very important, so that they can have the confidence and feel comfortable having conversations that are personal, touch on mental health as well. And I know Abigail's going to talk more about that. And then just the importance, recognising on the second point that line managers are in acute need of that guidance from HR, from their managers as well, because of the complexity of the situations that people in their teams will be facing that have so many implications for people's health and wellbeing at the moment. So they really do need ongoing support. And then at the bottom, their well-being can be so compromised. They are that squeezed middle, as I mentioned very often. They need to know where to go to get support, that no shame or reluctance, please, in accessing any support that's available to them, because their well-being is so important. We're expecting managers as well to be good role models, because people in their teams will be guided by how line managers behave. So they need to have healthy working habits, practice self-care, not work excessively long hours and so on. They will be really setting the tone for how people in their teams behave and look after their own health and well-being as well. So 3 guiding principles there. I'm just highlighting here as well other resources as well that we've carried out in partnership with other organisations, one with DWP on the left for managers. These are all directed at managers on how to manage people with a disability or health condition. And then in the middle are joint guidance with Mind on managing mental health. And then a number of joint toolkits, and I know Nick has already put one of these in the chat, with SOM and other organisations that are here on the webinar as well, and others on specifically around COVID. So I will leave it there, but there's plenty of resources to access that are free on our website. Thank you.
Brilliant, Rachel. Thank you so much. I mean, clearly, poor old line managers have got a lot on their plate right now, and it is incredibly challenging times for them. But I just wanted to share a question from a delegate saying, I work for a small organisation of 8, and many of these things around health that should be given are most definitely not in place. As an employee who may not have confidence in their line manager to offer adequate help, where can I go to identify my rights, and what help could I be entitled to?
I mean, it's a really good question, because not every organisation does have access to occupational health or even HR. And there are, fortunately, a lot of external sources of advice and support, that both in terms of health and wellbeing, for example, through Mind and so on, but also in terms of people's rights and protections at work. There's ACAS, lots of practical advice, and helplines as well, because sometimes you want to speak to somebody and not just download resources. And also, in terms of everything I've said about the important role that line managers play, and you might not be able to do a big sophisticated management development program, but actually a lot of what you can do to encourage line managers to have a positive impact and manage people in a healthy way, some of it is quite simple and straightforward. We've got a guide that I'll put in the chat box, which is really top tips really in terms of how line managers can support health and wellbeing. 6 steps you can take, and it just means doing things like getting to know your team better, leading by example, making sure workloads are manageable and so on. So really straightforward practical advice, and I'll put that guide, the link to it, in our chat.
Brilliant. Thank you so much, Rachel. Really, really, really great presentation. Thank you. And now Abby is delighted that Abby Hirschman from the Charlie Waller Trust is going to talk about having meaningful conversations when someone's in distress. So over to you, Abby. Thank you.
Thanks, Louise. Thanks, Emma and Rachel. So I think those are great platforms for where I'm going to go to now, which is a bit more of a sort of a laser approach to the work they've been talking about, to think about some things we can do in the workplace when we see that somebody is in distress. So I'm just going to give a brief sort of insight into the background to this project that I've been working on, or we've been developing at the Trust. So, well, how it started, I think for a long time I've been aware when I'm working with managers, or when I speak at conferences or training, that people often are thinking, we're talking about what mental health is, and we're talking about some of the signs and symptoms, but you can actually see in people's eyes, they're actually thinking, yeah, but how do I do it? How do I actually have these conversations? Because whilst there is a fantastic guidance, actually being in the room with somebody who's in distress can actually be quite difficult for somebody. It can be quite paralyzing. Even if you're a professional expert at it, can still be something that can be a challenge. So it's thinking about how managers can do it. The other area that really came up more recently is about those people who are in roles that their core role is not to support people's mental health, is not to provide support for that, but they're in a position in the course of their work where they come across people who may be in some sort of distress. So, for example, when I was at ACAS, the helpline, particularly at the start of the pandemic, people were ringing up. I mean, people rarely ring a helpline, do they? Because they've got good news. People are ringing up because they want support and they want help. But what was clear was that people were in incredibly challenged circumstances. We heard a lot of these from Emma in her presentation. So these people ring out for some practical advice, maybe around a contract change, or something to do their terms and conditions. But there was equally some mental health distress as well. And it was how that person, who that intermediary role, can help to support somebody to access help, whilst also giving them the practical guidance, whilst also that person in that role not feeling too destabilized and derailed by it. So then when we think about why it matters, well, we've heard some stats about the incidence of mental health and mental health distress. And I think this is also, as I said, about something to do with future proofing, something to do with looking after those people who are in those roles where supporting people in distress is not their core skill base or knowledge base or something they have to do every day. So it's about how they can keep themselves well and have what we've got is, which I'm going to talk about, is a framework. It's a very, very simple framework, but just to give that sense of containment for those people who are in that role. And these could be managers, these could be colleagues, or these could be people who come across, they want a helpline through the course of their work. They speak to people who may be struggling. So when I think about who it's again for all of that audience. We've done some work recently with an NHS trust, for example, so with some specialist nurses who deal with people who've got particular genetic conditions. So they're not ringing up about their mental health or supporting that element, but they're recognising more and more that people are showing signs of distress. And then we're also working with some librarians who work for a university, some managers, so lots of different audiences for this. And it's really about giving people some tools and some guidance in how they can have those conversations to move that person onto the support that they might need, while also being able to help them in the role that they're supposed to, they're supposed to provide. And as always, it's about spotting those signs. And we talk about this a lot in mental health at work, or, when you're a therapist, people are coming to you already. But when we're in these less heightened environments, it's not always obvious. And what's equally challenging at the moment is those different mechanisms that we're communicating with people through. So, the telephone or text messages or screens like this. So those spotting the signs which may be more available in a three-dimensional capacity, in that two-dimensional world that we're more exposed to at the moment, it can be harder to see when somebody might be in distress. And then we mustn't forget this, even if in the best environment in the world where everyone's really encouraged to talk about their mental health, people are still going to have things above the surface that they're going to show, and there's going to be things below the surface. And we're not expected to see, or, you know, people aren't necessarily need to share those things, but it's just being aware that despite the best environment in the world, you might not be aware of what somebody is struggling with below the surface. But essentially, it's about thinking. Mental health is really about how we think, feel, and behave. So what might suggest that somebody's thinking is slightly skewed? So they may be talking about things about, you know, being very self-critical of themselves. I can't do this. I don't know how to do that. I'm, you know, quite negative self-talk. Or their feelings, so it may be around, they may be a bit more angry, a bit more emotional, some other sort of emotional signs that their feelings are challenged. And then the other area is how people behave. So that's what we would tend to see more in a workplace context. So it could be people not coming to meetings or not performing effectively. So more obvious, tangible signs that then maybe if that person isn't helped, they might then end up going off sick, or other issues around that. So it's about thinking about those methods of communication, and then thinking about what you might experience or how people might express this. And then there's just some ways to think about it. So there's tone of emails and voice, the time the contact's made. And I know at the moment that's harder because a lot of people are working in a much more flexible way. So they may do work late at night when the children have gone to bed or something like that. But always be mindful of the time contact made, because sending emails at 10 o'clock at night, I would say generally is probably not a great sign that somebody's, you know, on top of things. They may choose to do that, but I think that's is quite important. And the same with very early morning. But then it's about having that conversation with them to ask them maybe what the reasons were that they sent it at those times. People like to turn their video off and on. So again, it's about thinking about people who never want to have their video on. What's that about? And then some other non-verbal cues, their presentation, how they may look, and then the productivity. So this is a workplace distress issue. It's about looking at their signs of productivity. So these are definitely some of the areas that will highlight if somebody's in distress. And then it's about having the confidence in a way and the knowledge to be able to know when to say something. But I always think that over the last year, I've probably asked more people how they're doing, thinking they're not right when they're actually absolutely fine. But I've asked each time, and even if they come back to me and say, you know, Abigail, back off, I'm absolutely fine, I've still made that interjection for people. So in order to sort of help people, as I said, who are in this position, my colleague Julie Castleman, who's an expert trainer in all areas to do with distress, she came up with this a framework called the Begin framework. And I'm just going to touch on some points in this, but every audience that we're working with, we're changing the guidance, the information slightly. It depends on who that end person is. So the first area is boundaries, and Rachel highlighted this before. You're not expected to be a counsellor or mental health expert, but you need to, if you have people in your organisation who you may have to help support, you need to have a clear agreed process about how that happens. The person who does it needs to feel confident so that they can recognise and respond to those signs of distress, and that is borne out by having, you know, good listening communication skills. The person who's helping, they need to be clear about the support available and facilitate access. And it can be as simple as just having something. I was working with an organisation, and it was a helpline, it was a few years ago, and they just had a list next to them of the local agencies that that person could get support from. Really important. About the boundaries here are about the helpers' boundaries, about really being clear about when they might feel out of their depth. The person on the other end of the phone or the computer screen may be talking about something that may be triggering for them. It may be something that they just feel is a bit too close to home. So realizing when actually they can't help. And sometimes people go into over-helping mode, and then it just becomes entangled. So it's about really being clear about, actually, this isn't something that I feel able to support this person with. And then a means to debrief if needed, and attention to self-care. So how you look after yourself if you're somebody who is frequently in your job talking to people who maybe are in distress. So then we move on to empathy, and empathy is sort of the cornerstone and how these conversations can happen and how they can progress. And it's thinking about how you talk. Somebody's talking to you. It's just, I can hear you are X, Y, and Z. It's always really important to reflect back what you're picking up on, so that person can be aware of what they're displaying, and it helps sort of draw the conversation back. And then if it's something maybe in a managerial relationship, this would be more appropriate that you ask them if there's anything you'd like to talk about. It may be a colleague. I think what's really clear over the last year, and it was highlighted earlier, is that mental health, we've talked about mental ill health, but actually people in distress, just normal difficult days, having normal situations, you know, every day that they're challenged by, in particular, I think since the third lockdown. These are colleagues, these are people we work with all the time. So it's not having to be too diagnostic with them. It's just about reaching out to our colleagues. I think there's a lot more lateral support going on now. And then if we think about empathy, there's different types of empathy. So there's the cognitive, you know, I can rationally understand why you might be upset about that. And I think if you want a helpline role, so your core job is to give them advice and guidance on something specific, that cognitive empathy is really, really helpful. So it doesn't, you don't engage too much with the situation, because then that would take you to an area that you're not familiar or confident with. And then there's emotional empathy, where people are more, you know, they really are in a feeling space with that other person, which is not something necessarily that would happen so much in a traditional workplace, but will happen maybe in more workplaces where there's a social care or social support areas. And then compassionate empathy. So this is what Rachel was talking about before. So this is recognizing someone is in distress and then doing something to help. And that would be much more around the management role, or maybe the collegiate role that we would have. So we've talked about the boundaries, and then we think about how we can show the person that we're on their side with this and that we want to help them. And then we need to think about guidance. And this is really about guiding rather than providing sort of, you know, strict information for them. So it's really about helping that person think about what's right for their situation, what sort of help they need. It's about that person taking agency, because this may be somebody, if you're a helpline advisor or somebody, you may not have another interaction with this person. So actually, what can you do to help them take away something that's going to mean that they can then go and access support? So it's maybe, you know, breaking it down. And if you're in a managerial relationship with them and somebody comes with a whole host of issues, it is helpful to take it one step at a time, to break it down. And the next step may be the next meeting. It might not all happen then. But if it's a one-stage intervention, sometimes asking people who are in a crisis state at the time to get them into a place where they can think. So asking them, what have you found helpful in the past, without going into too much detail, can be quite a useful intervention. Or, you know, have they thought about what might help now, and is there someone they can talk to about this? So you're guiding them to moving on to think about what they can do to help support themselves or get support. And then the next area is about that information. So it is about something a bit more tangible. And it's about, if they are in work or you work with them, these are areas of support that might be available to them. You might not know their workplace, but you could help them understand that these are different things that may be available for them. And I know that smaller workplaces have less access to these resources. So outside of work, there are lots of different places that people can go. There's the Hub of Hope. Don't know if people are familiar with that. It's a really excellent website that you can just go on with your postcode, and you can find local agencies and support places for you. And then IAP services, which you can self-refer, and then books and different resources, and Samaritan and Shout. So those are places where people can get much more listening, care and support. And then the next thing is to think about the next steps. So it's about avoiding making assumptions, especially if this is going to be a one-step conversation. You're not necessarily going to see that person again. Avoid making assumptions about what's going on for them. Recognise that mental health distress can go up or down, and they might not want the help straight away or need the help straight away. And what you might do in that one intervention, and this, as I said, is this is somebody you're not necessarily going to see again, is recognise that you have given them what they needed at that time. But if there is a managerial or an ongoing collegiate relationship, it's thinking about how you can bring this back, so how you can keep it on the radar. It's always better to ask again than not if there's that opportunity, and to think about the confidentiality. Encourage them to seek support. You're not there you can't change things necessarily. What you can do is help them access help that they need, and that's through your signposting and reassuring them, maybe talking about how other people have used this type of support. And then again, if it's in a workplace, if it's a collegiate or managerial relationship, continually to see those signs that maybe somebody is struggling. So maybe some leavism or presenteeism, or maybe absenteeism. So maybe something needs to be done to sort of keep that back, bring it back, to get them support. So in terms of other resources around here, there's these are listed on Gail's excellent sheet. So there's some other information that people get. People are in more heightened levels of distress. So if there's a risk of suicidal ideation, is how that can be dealt with. And then just to bring together the work that we've done at the Charlie Waller Trust, so we really look at this holistically. So when I think about this type of intervention, is very much thinking about how managers can develop skills, the how they can do this, how they can have that safety and containment around them, and then for colleagues, how they can connect with each other, because sometimes there will be colleagues in distress who you will feel more easily open up to than somebody more senior, and you can just help move them along to something that will be the right support for them. So our vision is about, it's a charity, we're a national charity, and we provide education, awareness and training for people on mental health. And we have a whole host of resources. We work with schools and families and universities and colleges, as well as the workplace. So all these resources are free, so please feel free to access them via the website. And that's me, and I thank you very much for your time.
Thank you so much, Abby. That was really practical, and I think we've all encountered people who are suffering from distress. So thank you for that. I mean, it struck me that the common theme across all three presentations is the importance of empathy, compassion, underpinned by emotional intelligence. So I'd like to ask all the panelists, or all our speakers, do you think that that boss from KPMG who told his staff to stop moaning and playing the victim card can learn empathy and compassion? And if so, can it be operationalized? Because at the moment, as Rachel said, for a lot of people, it's perceived as being rather fluffy. So Abby, would you mind if we start with you? You're on mute.
So you're talking about the KPMG boss who talked about the fluffy, yes, who left the organisation. I was really quite shocked at what happened there, and I thought I was shocked for two reasons. I was shocked because it was such a sort of a quite extraordinary thing to say, but I was also shocked but delighted by the press and the media attention it got, because I think what that is saying is what is becoming less acceptable, and where we need to actually invest in those softer skills and that understanding that just because you have a good job or you might have a good income, again, it's that iceberg. We don't know what's going on underneath. So I think the press attention that it got demonstrated how far we've come in the last year, and that these things becoming absolutely crucial for workplaces to invest and consider.
Brilliant. So do you think the KPMG boss could learn empathy, or David Brent from The Office? Can you learn this stuff?
Well, emotional intelligence, I think the research shows that our physical our intelligence stops at age 17, doesn't it? So anyone who's over 17, you know, it's slightly downhill from now on. But emotional intelligence, you can gain the skills and the competencies. I think for some people it's harder to do that, but it's definitely skills that people can acquire.
Brilliant. That's great. Thank you. Emma, can I turn to you next for your response to that? And thinking about whether one can operationalize empathy and compassion as well.
Yeah, and I'm sure Rachel will echo this. I'm probably stealing her line, but we know people in the UK are promoted into people management because they can do the technical requirements of a role and not necessarily the people management. And it's very different to facilitate and empower and support people to do a job. It's great if you have that technical knowledge yourself because you understand how you get stuff out the door. But in order to enable others to deliver that job, it's a very different skill set. I do agree with what Abigail's just said in terms of people can learn approaches. In terms of your very direct question, can it be operationalized? I mean, for me, if your manager every month or every 4 to 6 weeks has a catch up with you and goes through an agenda where they say, how are you? And they really listen and they can explore if you're saying you're not great, and or indeed ask twice if you just go, I'm fine, and don't breeze past that. If they talk to you and say, how is your well-being? How are your hours? What's your personal development? Are you getting any chance to do anything? Reflecting on the last month, what went well, what didn't go so well, and why, and do I need to support you with that? If you're then looking ahead to the next month, what's coming up, any pinch points, etc. So I do think a minimum level of pastoral support from a manager, we can give a framework for having these discussions, we can support this, but it needs to come from up high, saying it's not just getting stuff out the door, it's the how you get it out the door. And I think line managers being assessed as an annual thing about 360 feedback from their staff, really getting this ingrained into KPIs around how you support your people is how we really operationalize it, to be honest.
So do you think line managers should be recognised and rewarded for demonstrating empathy and compassion?
Yes.
I thought you'd say that. Rachel, can we end with your comments, please?
Yeah, sure. I mean, I'd agree with everything that Emma and Abigail said. And I do think, yes, it comes more naturally perhaps to some managers to show all these behaviours that are good for well-being, so compassion, empathy, dealing with personal issues, not shying away from emotion. It might come easier to some than others, for sure, but I do think, and not everybody would agree, but I do think everybody can be trained, but that doesn't just mean, I talked about training a lot, but I didn't mean just a one-off training course. Actually, what I didn't have time to talk about was it's the whole organisational context that's so important to reinforce that training as well. So it isn't, I'll send a manager on a compassion training course. I mean, it can be part of the jigsaw, but actually what you need is an organisational where those behaviours are constantly reinforced and rewarded, as Emma suggested as well. Managers need feedback on how they are behaving. You need the culture, and leaders, we've talked about leaders briefly, they have to be authentic and genuinely supportive of health and well-being and managers behaving in a certain way. So it needs constant reinforcement in an organisation. It won't just happen, and it'll fall away if it isn't reinforced.
No, thank you very much. And just like to say a huge thank you to Emma, Rachel and Abby for really excellent presentations. And thank you. And at this point, I'd like to hand back to Nick, please.
Hi, thanks very much, Louise. Wow, what a great afternoon. We can keep this Zoom open for a bit. I don't want to call on the time of the speakers or you, Louise, but we're supposed to be ending at 3:30, but I can see there's questions are coming in. So if people want to come off mute to share their questions or their knowledge. The chat's been full of some useful resources, and we'll share that so you can see the links if you can't pull them off. Gail Kinman is writing a briefing very bravely that's going to go on .gov based on sorry, going to produce a fact sheet based on the briefing. So if you do have further resources, I'm sure she'd appreciate it. But yeah, lots to reflect on. Very difficult time, and a very, very good session. Any kind of final, if there's someone who's absolutely bursting to ask a question verbally, I can see an old friend wanting to ask, but does anyone want to come off mute to ask a quick question in the last couple of minutes?
Hi, good evening. My name is Arvinda. I'm from Malaysia. I've been following these SOM talks and it's very good. I would just like to ask Emma a question. We have a problem here in Malaysia and I was wondering how did the UK deal with it? We have sick leave here in Malaysia, which we call medical certificates. And I have been pushing for quarantine to be not part of this medical certification. Like, for example, if you have people who are going to be quarantined at home, the problem is right now that, some of the people who are working in the private sector, the particular leave comes up from their annual leave or even their medical leave. So I was wondering, how did the UK do? Do you all have any special issues or did you all come up with anything for quarantine purposes that you are able to quarantine for more than 3 times a year without pay being minused and, that sort of thing? You get the gist of the question, Emma?
I think so. I mean, that's not specific to mental health.
Right.
Rachel, did you have any insight on that or wanted to come in at all?
Well, in terms of the UK, they have made available statutory sick pay in response to the pandemic for people who are in a situation where they've got COVID or have to isolate and so on, quarantine. But it's quite a low level of sick pay. I mean, in terms of how organisations approach that kind of absence, we are encouraging organisations to not count COVID-related isolation and so on within their normal absence reporting frameworks, because that could unfairly penalise people and through no sort of issue that they've had control over. They have to take time away from work and so on. And if they can't work from home, and then they're well but have to isolate or quarantine, then it's really difficult for them to if it's going to be counted as sick leave. I don't know if that's helpful or not, because I'm not really that familiar with. We've got members in Malaysia, but I don't know the specific situation there. But it's a difficult issue for every country and every organisation at the moment.
Sorry, Rachel, does the UK offer compensation for this type of things? For example, leave at home because of multiple times of being quarantined? Thank you, everyone.
Yeah, well, they have also introduced, the UK government, a one-off payment of £500 for people who have to isolate or are off sick because of COVID, although people aren't always successful in their application to receive that payment. And I think other discussions are underway. But it's really important in terms of countries' governments supporting people to be able to quarantine and isolate when they need to. And financial well-being is a really important part of that.
Okay, thanks. I think, Arvinder, we're going to probably close the kind of Q&A now with the speakers, and thanks to them and Louise for hosting and presenting. And the recording, as I said, will be sent around along with evaluation.